Okay, welcome to PACT Training. That's the Professional Academy of Clinical Thermology. Today, we're here with Dr. Alexzander Sepper, welcoming him as a co-director this year in 2013 of PACT. Dr. Sepper, welcome.
Thank you very much, Dr. Piana. It's my pleasure to be here, and let me, from the beginning, express my gratitude with the Academy, with entire staff here. It's a real pleasure to work with you guys, and I hope that today and in future we will do a great job and we will increase the interest of public as well as medical community to this wonderful method of diagnostic. Thank you.
Excellent, Dr. Sepper. Would you be able to give us a brief background? I know most people are familiar with your background already within our organization, but in case there's other or people that are new to our organization, if you could go ahead and do that for us.
Yes, I am a medical doctor with more than 30-year experience in oncology, and I was a leading thermologist in the Georgian National Center of Oncology. I have PhD in thermology, and I believe I have enough practical experience and theoretical experience in medical thermology, and here in the United States I was lucky enough to meet Dr. Piana with his staff and become a member of Academy, MD, PhD in medical thermology. Thank you.
Thanks, Dr. Sepper. I find it very interesting that in America we've heard very little about ovarian cancer and thermal imaging, but I believe you have your thesis on ovarian cancer, is that correct?
Yes, my dissertation was the use of thermography in primary diagnostic and of ovarian cancer, and the results, it was many years ago, and we were using old thermography equipment which today is incomparable with the modern thermography equipment, but even using these old thermographic cameras we were able to increase the diagnostic and differentiation of ovarian cancer up to 86%, and that was the amazing result at that time when we were very restricted in using of different diagnostic methods. So I can state now that in the practice of Georgian Oncological Center, the thermography of ovarian cancer became one of routine methods, and it gave a lot of valuable information to surgeons as well as oncologists who performed chemotherapy or radiation therapy. And with the help of this information by thermography, the results of treatment were increased up to 34%.
Well, that's fantastic. I, as a co-director of PACT, have been traveling around the world over the past several years, meeting with different thermologists around the world, and when I presented your work to these people, they're very amazed at this, that it was so, well, we haven't heard about this before. So one of the things that we want to do is promote this type of knowledge around the thermographic community around the world. So at the same time, as a new director yourself of PACT, what direction do you see PACT heading?
You know, having enough experience in medical thermology and you know, constantly reading the medical literature, not only in thermology but let's say in oncology. I believe that the first and the most important way of the development of this method would be the same: mass screening of breast pathology. Thermography, as we very well know, was started with breast pathology, and today, if I'm wrong, correct me, Dr. Piana, probably around 90% of thermographic diagnostic goes to diagnostic of breast pathology. I think that the screening of women with to reveal and to diagnose breast pathology, breast cancer, these hormonal breast diseases, as well as inflammation, would be the priority. But I am far from idea that this would be the only application of thermography. There are today increase, let's say, frequency of skin pathology, skin cancer, melanoma, which could be and can be diagnosed by thermography. I'm not afraid to say 100%. There are a lot of cases of thyroid cancer and other thyroid pathologies that could be diagnosed also in very high percentage. Let's say pathology of soft tissues also can be diagnosed with thermology with very high percentage and very high sensitivity. So I believe that there are a lot of different applications for this very inexpensive, uninvasive, not invasive, and effective method. So in the academy, with all the staff and especially with Dr. Piana, we have regular meetings, and believe me, we thinking how to go to public, how to improve our communication with medical community as well as patients. And I believe we will continue working on this direction, and very soon I believe we will achieve the results in terms of proving that thermography is effective, inexpensive, not invasive, and it should be, not could be, but should be used in screening of different kind of pathologies, as well as today, for example, medical doctors who use this method, they coming and they start to believe that they're getting a lot of very valuable information which can help them to diagnose and to treat the patients.
Excellent, excellent. So I think a lot of people, we've spoke about before the mass screenings that you did in the early 90s, late 80s. One in particular we published on the PACT website, which was the mass screening of 18,000 women at a factory. I understand that it's difficult for some people to understand how you can be this efficient with this type of technology. Some people to the fact where they just simply don't believe it. Can you reiterate the logistics behind doing that? We have the results, it's posted on the website. You all should be reading the article and understanding these articles that we're posting in the PACT journal. But I'm even curious more about the logistics behind that. How did you do this?
We, in former Soviet Union, at the Center of Oncology in Georgia, we were pioneers of using thermography in Soviet Union, and a lot of fresh brains came to the department. A lot of enthusiastic people who, of course, had support from the seniors of the center. So when we came to the conclusion that thermography can serve as a method of the mass screening, and having not only our own background but also very clear information from other researchers from other countries, from the United States, France, Japan, we decided to prove ourselves on mass screening, and we approached the directors of the huge plant in Georgia, Rustavi plant, chemical plant, where thousands of women in different ages were working. And during several months we performed 18,000 thermograms of breasts. By the way, at that time computers only entered medical practice, entered the method of analysis of information, so we also used the computerized database, and it was pretty long work. We were working on this issue several months, but when we analyzed the information which we got after this thermological study of women, we were surprised ourselves that a lot of breast pathology was revealed, diagnosed, and then when we created the suspicious group of people whom we diagnosed by thermography different types of breast pathology, and performed other methods of diagnostic like mammography, sonography, in some of them biopsy, needle biopsy. We were surprised how exact and close to the truth was our thermographic diagnostics. And of course then we started to call these people to our Center of Oncology, and believe me, we got a lot of letters. Dr. Piana, you would be amazed how many letters, thank you letters, we received from the patients as well as from surgeons. And I believe that that was one of the first works in breast pathology screening, and that that proved my feelings first, and then using my background, that thermography is one of the most efficient methods of screening. So I shared this data with Dr. Piana, and in private conversation I told him about the details. Thermography is not the standard, whatever you achieved and that's it. No, it's dynamically developing method. Even today we have excellent equipment. We probably have to work more on the criteria of the analysis of thermal information. how to increase the diagnostic possibilities by this method. But I believe that since that time thermography was and still is one of the, it should be one of the leading methods in mass screening of breast cancer, and maybe of the mass screening of other organs too.
Yeah, Dr. Sepper, thank you. I will be posting sometime during this training the analytical study that you and I did regarding just even the financial burden of each technology separately. And there's a quote from you somewhere, and I'll even post the quote, but maybe you want to just elaborate on it, where in no way is what you said, and I'm summarizing, in no way is mammography, has it ever been determined to be economically efficient, okay, or even the possibility of being able to cover the masses of all the women around the world. It's non-feasible at this point, and if you want to elaborate on that, you can.
Yes, you are absolutely right, Dr. Piana, because based on the technical issues, based on the economical issues, mammography cannot serve as a method of mass screening. It's impossible, because nobody, I believe there is no organization, even government, cannot afford the mass screening. I mean, thousands and thousands of mammograms. It's impossible economically, financially. At least I don't see these possibilities. If we add to this the latest article that you mentioned today in conversation with me, that the British publication, that the mammography also there are the high percentage of over-diagnostic with mammography. We can come to the conclusion that up for today mammography cannot be very efficient in terms of mass screening, and we have to look some other ways. And why should we go far in this search when we have the excellent method of thermovisual diagnostic, which is much less expensive, which is very informative, which is absolutely not invasive, and can be performed in matter of minutes, and we can screen very large population of women for breast pathology. So I don't see any obstacles to do this. The only way is to convince the medical community, as well as people who handle these questions, to turn their face toward this excellent method of diagnostic, I mean the thermography, and use it, and use our knowledge, our experience, and we are ready to serve our people for this.
Yeah, and actually, Dr. Sepper, what you were referring to was the article in the New England Journal of Medicine, American Journal, and that says that the increase of, actually the use of screening mammography over the past 3 decades has shown minimal decrease, or I should say insignificant decrease in mortality, yeah, as well as 1/3 of overdiagnosis of cancer and treatment of cancer. So that's huge. So in other words, I think to reiterate what you just said is we need a supplemental approach to breast screening. In other words, what's the gold standard out there? If that's going to continue to be the standard of care, it needs some serious help, because it's only 83% effective, and that's in women with non-dense breasts, and it's a lot less effective in younger women, as well as, you know, some people worry about radiation as well. So,
I am far from the statement that we have to forget about mammography. No. Mammography today, up to date, is the gold standard of diagnostic and even as a screening method. But based on the data which was published in the recent article, as well as data which were published in other articles, we came to conclusion that mammography needs some support, very serious support, very informative support. And in this way, thermography can work excellent way. And I will repeat that based on that the thermography is relatively not expensive, this support would be not only on the information ways, but also the financial ways. So I believe that continuing working and members of Academy, and we will achieve that people come to, even people who handling the mammography, they will come to us and ask us for support. And that would be very important and very useful in practical way.
very good. And leaving the cancer detection component of thermography gracefully behind, let's move into the promises of using thermal imaging with an ever-growing cancer population for breast cancer, into the causes, and including estrogen toxicity and the detection through thermal imaging. And I know you have a whole lot to say on that, and I'm going to let you go with that.
Unfortunately, today the problem of cancer is still very actual. And let's leave for a second this problem aside and talk about the causes that bring to this condition, to the cancer. And one of these conditions is estrogen dominance. We called it in my country of origin, we called it the dyshormonal disease. Here we call it estrogen dominance, and believe me, it's a very, very serious problem. By the way, I would like to start with the information that thermography is the leading way of non-contact diagnostic of estrogen dominance. Yes, of course you can take the blood and determine the concentration of different estrogens and then compare them and diagnose the estrogen dominance at the certain level of reliability. But seeing thousands of thermograms of women and men, by the way, I can tell you that we can diagnose and we can give doctors the very, very specific and very broad information about the estrogen dominance, particularly in women. Especially today, when estrogen dominance develops on the background of constant stress. We all live in stress today, and unfortunately it is unavoidable. And the main hormone, main biologically active substance, cortisol, which handles the stress, which prepares our body to resist the stress, is formed from progesterone. So we depleting our depot of progesterone by producing the more necessary at this moment hormone cortisol. If we take in consideration then after, let's say, age 35 to age 50, we see the gradual decrease of estrogen and progesterone, but the ratio between them is very significant. If at that time, if we have the decrease of production of estrogen 35%, only 35%, at the same time the progesterone decrease at 75%, and the dominance brings us to the conditions, and actually these are pathological conditions when estrogens dominating in our body brings the proliferation processes of different kind of tissues, especially in sexual organs like ovary and breast. So this is very, very serious problem. And by the way, I heard that some technical personnel from academy told us that patients coming and saying, oh, I don't have any estrogen dominance, nobody told me this. Yes, nobody told because they didn't have the thermography results. And thermography revealed this, this estrogen dominance, and doctors who treat these people, maybe patients, maybe they have to, not we advise, we telling them that they have to take in considerations the thermographical data from our side, and it would be the great help in the way of treatment strategies. If we take that, we also use a lot of plastics, a lot of different materials who are estrogenogenic, then this ratio between estrogens and progesterones will go even deeper, and we will have a lot of estrogen dominance situations and conditions that are caused especially with the style of life, with the use of different non-useful for our health materials, like plastics, like pesticides, like other groups of substances that today are used on the industrial level. So that's a very important issue.
Yeah, actually, that's a very good point there, Doc. I'd like to add a couple of things. The first being that there are more than the 3 natural types of estrogen that are found in the body, E1, E2, and E3, in the environment. There's been identified 26 types of estrogen so far, and we keep identifying new ones all the time. These estrogen substances actually act on the estrogen receptors just like E1, E2, and E3. So some women that go for blood tests and find out that maybe their blood levels of estrogen in relation to progesterone are not estrogen dominant, may have these other estrogens in their system that are acting on the receptors that we're seeing on the thermal imaging. Okay, and so I think some practical things that our members might want to hear is some natural ways to decrease estrogen dominance naturally without having to take a cream necessarily. What would you recommend?
That's important question, and today a lot of endocrinologists, a lot of gynecologists and other practitioners coming and to the belief that the biologically identical hormones which can be used are very efficient, not horse progesterone, but biologically identical natural progesterones are very, very effective. They can be used per orally, or more efficiently as a patches, or as a gels or creams topically. And thinking about this way of delivery, discussing this, we came to the idea that probably the use of penetration enhancers would be effective to supply the normal level, normal amount of necessary amount of progesterone to organism, because skin has its barrier and is a barrier system, and using these penetration enhancers with the natural progesterones will increase the efficiency of such kind of treatment. Besides of this, probably we all can recommend to avoid as much as possible the stress, to have a healthy food. I mean, food which is grown on pesticides and fertilizers, which have very, very strong estrogen activity. They probably look nice, but are they healthy? Are they useful for our body? Not. So we should advise patients with estrogen dominance use healthy food. This is very important. For example, by the way, Dr. Piana, I was talking the other day with a lady who is working for city at laboratory, which analyzes some containers, some kinds of food. And when I mentioned this problem, she told me that, and they will probably publish this data very soon, she found that, let's say, spring water stored in plastic bottles contains 18 times more estrogen-like substances than water that was stored, for example, in pure glass. And people have to know this and avoid these plastics. This is a very serious problem. And having a lot of patients in our academy, we have to deliver this information. People have to know this and avoid as much as they can such kind of materials which can bring the estrogen dominance, because estrogen dominance itself has the clinical manifestations, but the most important that when the estrogen dominance persists, then we are facing such a serious problem as cancer. And actually fighting the estrogen dominance, we can call it in future as one of the ways of prevention of cancer development.
Okay, and to actually, interestingly enough, this morning on the Facebook Professional Academy of Clinical Thermology page, I posted the Wikipedia article on BPA, which is bisphenol A, which is what we're talking about in plastic water bottles, as well as BPS, which is bisphenol S, that it has the same estrogenic effects. And if you heat these waters up in the bottles, or if they've ever been heated up in the past, it increases it up to from 70 to 95%, which is a huge difference. Interestingly, too, I know that you and I monthly go out for dinner in New York City, and my favorite new drink is Borjomi, which is a Georgian bottled spring water, which has natural carbonation in it and a lot of minerals. Excellent for you, of course, as you've explained to me. However, interestingly, it comes in glass water bottles. Absolutely. And you look at Perrier, same thing, a French company, so people know this. Some of the, non-American companies have known this for a long time, apparently. Whereas I think people need to pay a lot more attention to this. And not just women for breast cancer, but for all Americans, men and women.
Yes, if you look products which coming from different countries, especially I am familiar with products from Georgia, I know that this mineral water, as Dr. Piana mentioned, coming in glass water. If you take, let's say, Georgian wine, it comes either in glass water or in clay water, which is even more natural. In clay bottle, you can keep the wine, I don't know, very, very long time, without refrigeration, without anything, simply in cool place. And the wine never spoiled. So we have in our hands very excellent natural materials. Why should we use plastic? Because they are cheap.
Excellent. And you hit a point earlier about natural progesterone and the research that PACT is doing now to see the effects thermographically on breast tissue that were estrogen dominant prior to the application of this penetrating progesterone cream that you're speaking of. And we've had some early success in some studies that you and I have done personally with my patients. And we would like to extend this to our PACT members to continue our research, our experimental research, through PACT, which is a 28-day protocol with our undisclosed topical cream that we're using and being applied in specific areas on the body. And anyone who's interested, which we hope it's all of you, to get involved in this with some of your patients with estrogen dominance. And we have the sample preparation kits at $25 per patient to get involved with the study. We require a minimum of 10 purchases per technician to get involved with the study. So we need 10 from each of you. And some of the studies will be, the pre-study will obviously be the study that they come in for, but the post-study would be analyzed at no charge 28 days later. And we'll work out the details with you specifically. But please email us for that to get started. It's very important for us to do this type of research. We're the only thermographic system out there that is doing this at this point in time. And so far, the early results are awesome. The other thing I want to mention before we close out here soon is that we are starting our Sepper series. Dr. Sepper has agreed to, in some cases, go live, in other cases, record a series. Will be an additional cost per member. We'll make it reasonable, but we do need funding for certain projects we're working on. So this is one way we're looking to make the money, as well as give you some of Dr. Sepper's background and some projects he worked on that are, to me, very fascinating. I've spent maybe 100 hours with him already or more discussing some of the things they've done in the former Soviet Union that were being done up until the point literally civil war broke out in Georgia, supposedly, from what I've heard from Dr. Sepper.
And believe me, with Dr. Piana we have much more in future, coming soon.
Yeah, so we want to share some of his amazing experiments. I've told you about a few of them, but I'd like to get it firsthand from Dr. Sepper so you guys could hear. And this is available to anyone around the world that's listening to our presentation here. So I know our friends in Brazil are very interested in your work, and they've agreed to bring you down to Brazil and take care of your expenses to hear some of this. So you guys could hear this on a, whether it's quarterly or every other month basis, depending on what works out. But I want to know your commitment. Are you guys willing to join us each month or every 2 months to do this? So I want some feedback. I want everyone to let me know by email tomorrow or today what you guys think of this, because we're ready to take the next leap with this. We just need some support from everybody. Dr. Sepper and I can't do everything ourselves, as well as we want you to help out and also support us financially so we can do this. And even get possibly donations from your patients to help support research in thermography. It's the only way this is going to take off. Dr. Sepper, do you have anything else you want to add to this presentation?
No, nothing special, but I would like to tell all members, academy members who will listen us and watch this video, and personally say I'm very thankful to my good friend Dr. Piana. Why? Let's forget about humanistic part of this. This is probably one of the top professionals in this field. This is the person who loves this method, who believes in the future of this method, and who does everything to not only popularize but also prove to other professionals that this method is very important, very useful. And from my side, I also would like to ask all of you that do whatever you can to deliver my Dr. Piana's voice to other people, because I believe that thermography should take its own high place in the routine methods of medical diagnostic. Thank you.